Unveiling the real cost of back surgery. Meet Lucy, a hardworking American struggling with chronic back pain. She's considering back surgery as a potential solution, but does she know the real cost behind this medical procedure?
Lucy, back surgery can be a viable option for certain conditions, but it's essential to understand its true cost. Let's dive into it.
First, there are pre-surgery expenses, such as consultations, diagnostic tests, and imaging scans. While insurance will help, those co-pays still end up costing hundreds, if not thousands of dollars. But before surgical reimbursement can be approved, some insurers will require you to try other interventions, such as physical therapy or an epidural steroid injection for temporary relief. An ESI is where the doctor will inject steroids directly into the epidural space of your spine. Like any medical procedure, ESI involves risks. Once you do get your surgery coverage approved, health insurance plans often have specific rules and limits. Depending on your policy's details, you will also have significant co-pays, deductibles, and other out-of-pocket expenses for things like braces or rehab and medication. A 2018 study published in the Lancet Medical Journal states, patients should avoid harmful and useless treatments, and doctors need to address widespread misconceptions about their effectiveness. For example, there is limited evidence to support the use of opioids for low back pain, and epidural steroid injections and acetaminophen are not recommended at all. Once scheduled, the surgery itself comes with significant costs. There's the surgeon's fee, anesthesiologist's fee, and charges for the operating room and medical supplies. These expenses can quickly add up. By the time a patient pays deductibles and co-pays reach their max out-of-pocket, the typical back surgery co-pay costs $7,000 to $10,000. And these expenses still do not cover the cost of medications, post-surgical follow-up, and physical therapy or rehab. With these additional expenses, the total out-of-pocket expenses can easily approach $12,000 to $18,000. And of course, there are serious risks to surgery. Infection, nerve damage, or permanent disability are all real risks, as is the risk of failed back surgery. Some studies show the failure rate of spinal surgery to be as high as 50%. Microdiscectomy has an overall success rate of about 74%. And while not a topic anyone wants to dwell on, mortality rates increase when hardware is used in conjunction with surgery under anesthesia. Remember that most patients will require 2 to 6 weeks of recovery time, so the loss of income for recovery time can be a significant expense too.
I never realized the real cost involved in having back surgery. It's a lot to take in. I also did not realize how serious this surgery is and how often it fails to actually reduce the pain.
No procedure has a 100% success rate, so it's essential to weigh the potential benefits against the financial burden. Always consult your healthcare team and explore alternative non-surgical treatments when available. IDD therapy advanced spinal decompression has proven 92% successful in resolving spinal pain for people who were scheduled to have surgery but tried IDD therapy instead. No drugs, no needles, no invasive procedures. It's safe and cost-efficient.
Lucy has gained valuable insight into the real cost of back surgery. Armed with knowledge, she can now make an informed decision about her healthcare. Understanding the true cost of any medical procedure is crucial. Get informed and be proactive in managing your healthcare and your healthcare expenses. To find out if you're a candidate for advanced non-surgical spinal decompression with IDD therapy, contact us at www.iddtherapy.com.